just a drop and a minute away from painless closure of wounds and quick healing. Cutseal, the revolutionary solution to sealing all cuts and incisions effortlessly. Cutseal is the brand new revolutionary tissue adhesive, a magic drop of which will ensure union of cut or incised wounds. Just spread a drop over the cut, and within seconds the wound will seal in front of your eyes. Cutseal, the best solution for wound healing. It's painless, instantaneous and leaves no suture-like marks or scars and is cosmetically the best. Cutseal contains the time-tested ingredient N-butyl 2-cyanoacrylate, a novel tissue adhesive having a unique mechanism of action. When applied, the ingredient comes in contact with the skin moisture and chemically changes into a polymer that binds the layers of the skin. The polymer then forms a cyanoacrylate bridge binding the two wound edges together and allows normal healing to occur in an absolutely safe environment. The conversion of the compound from monomer to polymer occurs rapidly, forming an impermeable bond, preventing any seepage from the wound. Patients may sometimes experience warmth during application as mild heat is generated during the conversion of monomer to polymer. The polymerization is very fast and is complete in approximately 10 seconds, with maximal bonding strength within 2.5 minutes, equivalent in strength to healed tissue at 7 days post-repair, which means that Cutseal gives your wound the perfect bond within minutes of application. Cutseal's ingredient cyanoacrylate is a time-tested tissue adhesive having enjoyed more than 30 years of clinical use and has over 600 clinical publications. The N-butyl 2-cyanoacrylate derivative is the latest cyanoacrylate tissue adhesive used in Cutseal. Cutseal is blue in color and thus is easily distinguishable and is used for the closure of uncontaminated wounds. It is an absolutely painless alternative to sutures and staples for wound repair. It can be used in all types of surgeries, in emergency rooms, trauma units and also in first aid situations. It should not be used on the brain, neuronal surfaces and in vascular surgery. Cutseal is today gaining wider acceptance in various areas of surgery like general, plastic, pediatric, orthopedic, urogenital, obstetrics and gynecology, ENT and ophthalmic. It is ideal for the closure of skin puncture sites, that is around central venous catheter skin puncture sites to fix catheter to skin. Dentists are increasingly using it for the sealing of tooth sockets after tooth extraction. It is equally effective in veterinary practice. The three main features of Cutseal in the closure of wounds are that it is painless, instantaneous and leaves minimal scars, thereby gaining wide acceptance and continuously increasing its market presence. Let us now see how exactly this wonderful product works. The wound should be cleaned thoroughly and the skin must be dried optimally. Use tissue forceps to evert the skin edges so that it is not rolled inwards and the edges meet perfectly. The wound edges should be straight and should lie together. Hold the Cutseal ampule upward and break it. Aspirate the contents in the sterile dropper provided with it. The wound edges must be stabilized. Cutseal is applied in the form of tiny droplets at appropriate intervals where the wound edges meet. During application, do not touch the tissue with the dropper. Cutseal will stiffen within seconds as it polymerizes. There are a few precautions to be taken while using Cutseal. One Cutseal ampule is for single use only in its liquid form. The product should be discarded if it turns viscous. Do not place a continuous layer of Cutseal between two cut surfaces. Avoid contact of Cutseal with surgical instruments, gloves and fingers during application. Cutseal has many advantages compared to the conventional suture method. Cutseal gives excellent cosmetic results. It possesses a high degree of mechanical strength. A local anesthetic is not required during application. It saves precious operation theatre time. In case of accidental adhesion, the wound can be reopened by applying acetone or dimethyl formaldehyde. It is more economical as the duration of the treatment is reduced. Sterilization of instruments is not required. Usage is simple and uncomplicated. Cutseal has great shelf stability and polymerizes rapidly when applied. It is non-allergic and has antimicrobial as well as bacteriostatic properties. It is non-histotoxic and non-carcinogenic and produces considerably less edema and granuloma formation than conventional sutures or staples. Cutseal is available in 0.15 ml and 0.25 ml packages. One pack is sufficient to make a closure of 15 cm and 25 cm of wound respectively. So, switch to Cutseal and give your patients a clean, scar-free and pain-free healing experience.